In this trial, we enrolled patients with recurrent metastatic head and neck cancer being treated in the first-line recurrent metastatic disease. They needed to have a CPS of 1 or more. And in this trial, we did assess the level of LAG-3 and the level of CPS. So the combination was a PD-1 with a LAG-3 and a TIM-3. We compared the results of the anti-PD-1 with the anti-LAG-3 and the results of the anti-PD-1 with the combination of two other drugs, the LAG-3 and the TIM-3. The primary endpoint of this trial is progression-free survival. For that endpoint, we did not observe a meaningful difference in the progression-free survival between the PD-1 and the PD-1 plus LAG-3. And when we compared the results of the PD-1 to the triplet, also we did not find a meaningful difference in the progression-free survival. Also, assessing the response rate was 20% with the PD-1 antibody alone. And when we added the LAG-3, that number increased by 10% to 30%. And the same thing happened when we compared the PD-1 with the triplet. So the results of this trial essentially are telling us that the combination of a PD-1 with a LAG-3 or a PD-1 with a LAG-3 and a TIM-3 did not improve outcome in patients with recurrent metastatic disease. These results add to the body of evidence we have currently with these combinations, that the combination of a PD-1 inhibitor with a LAG-3 and TIM-3 is not improving outcome in patients with recurrent metastatic disease. This is not the first trial to show this, but it adds to the other data we have with these combinations and really raises the question whether this is the best setting to test these agents or whether there is a room to look at these agents earlier in the disease process, such as, for example, neoadjuvant immunotherapy in head and neck cancer patients. Thank you.